Assalamu alaikum and welcome to Out of Sight, a podcast show aiming to raise awareness about disability and special needs. We explore areas of inclusion and accessibility within our communities. On today's episode, I'm your host Sarah Hamza, and with me I have a lovely guest, Dr. Kieran Najabat. Dr. Kieran is a consultant child and adolescent psychiatrist and the founder and director of the Family Wellness Practice. Dr. Kieran graduated from Guy's King's and St Thomas Medical School back in 2008 and gained an intercalated BSc in management from the Imperial Business School. She went on to train on the UCL Core Psychiatry Training Scheme and the Travis Dock Higher Training Scheme. Dr. Kieran is passionate about mental wellness and uses her expertise to educate children, adolescents, their families and professionals through workshops and CBD accredited courses. In the past 5 years, Kieran has led the Family Wellness Practice team and has developed and delivered 10 CPD accredited courses, mental health related courses covering a range of subjects including mental wellness, building resilience, parenting, self-harm and suicide prevention. The Family Wellness Practice team have delivered bespoke mental health training and counselling to over 5,000 staff, parents, students across various sectors, including schools, colleges, nurseries, orphanages, residential homes, charities, places of worship, and hospital staff. Dr. Kieran is a regular keynote speaker at mental health conferences and has received outstanding feedback both nationally and internationally for her work and strives to be at the forefront of mental health education. So, quite impressive, Dr. Kieran. Sorry, I messed up a little bit with the wording.
Thank you.
But very, very impressive, and I'm honoured to have you on the show today. Inshallah, it's going to be a very, very interesting conversation. So how are you today?
Alhamdulillah, good, thank you.
Alhamdulillah. Why don't you just start off by telling us a little bit about what your job entails and who you are as a person, your career and your vocation?
So you've kind of summarised it quite nicely through my profile. But as you said, I'm a child and adolescent consultant psychiatrist. I work part-time in a paediatric ward in a hospital. And I spend most of my time working with children and young people aged between, well, it can be from 0 to 18. And a lot of these children and young people present with behavioural difficulties, mental health problems and difficulties, and a combination of presentations tend to be those that present in crisis, so children and young people that may have severe anxiety, panic attacks, and present with, unfortunately, self-harm and suicidal thoughts and attempts. The other half of my time is working in the interface between physical and mental health, where children and young people might present with stomachache or headache, medically unexplained symptoms, and then I try to kind of look and understand, work with the family and the paediatric team to really manage their mental and their physical health.
Wow. So you do quite a lot on a day-to-day basis.
Yeah. So sorry, I just spoke about part of my role. So then the other part of my role is the director of the Family Wellness Practice, which is a private clinic that delivers mental health training, as you mentioned, CPD accredited courses mainly in schools, but in other organisations as well. And we do that for parents, students and staff. And I will be launching my private mental health clinic next month, where I'll be assessing children and young people with kind of difficulties such as anxiety, depression, query, ADHD and autism.
Inshallah. Inshallah, wow. So you do quite a lot in your day-to-day basis. So what is it about your job that you love, and what do you find the most kind of interesting?
Good question. I think the reason why I chose child psychiatry is because what I really love and what I really feel passionate about is intervening early. So we call it early intervention in psychiatry, because we know that 75% of mental health problems are diagnosed by the age of 25, wow. And 50% are diagnosed by the age of 14. So I think I understood quite quickly that if you work with children and young people from an early age and their families, you can prevent the deterioration of mental health problems and help them to manage their mental health a lot better than maybe if you were to see them in their 30s or their 40s. So for me, I really believe that, you know, early intervention, public health promotion, this is the kind of field that I feel really passionate about. And that's what I really love and I really enjoy. But at the core of my work, what's involved in it is really understanding from the young person's perspective what their difficulties are, but not just working with the young person, but working with their family, working with the whole system around that young person, whether that be their school, their community, the organisation that they may be a part of, like for example, they might have a hobby like football or art. We work with a whole network of people, and I think I really feel quite passionate about working within a wider kind of multidisciplinary team and network to support the young person, and that's another aspect of the job that I really love.
Yeah. Wow. So you touched upon a really good point there about the role of the support network. So the family, the community, the specialist when they're practicing out their hobbies. What is actually their role in, let's say, for example, a child that has just received a diagnosis?
So when you say diagnosis, do you mean any kind of like mental health diagnosis?
Yeah.
Because
so the children that you kind of see on
yeah. So there's such a huge spectrum. So like, for example, we could see children and young people that may have a diagnosis of autism, which is a social communication difficulty. Now, you can't necessarily visibly see that condition in the same way that maybe a child that has cerebral palsy and is in a wheelchair, which is obviously a lot more noticeable than someone who is, not necessarily socializing or talking as much. They both have very different needs, but equally they both require a lot of support. So with a child or a young person with autism or a learning difficulty or a reading difficulty such as dyslexia, what we would do is we would first of all understand what their main concerns are. Then once we've done that, often children and young people with a diagnosis of autism or ADHD or kind of dyslexia with anxiety would find it quite difficult to, they'd be quite anxious in social situations, including school. So what I commonly see in my practice is children refusing to go to school. And so then I would need to work with the family, with the school, with the child. That's a whole network of people, with the SENCO, the specialist educational support that's available within the school to really try to reintegrate the child back into school. So that's an example of working with a network to help a young person with a particular difficulty.
So essentially there are a lot of, it's a multifactorial kind of thing, isn't it? Where it isn't just a child that has, let's say, autism or dyslexia, or there are secondary things that we have to deal with around that child that maybe one doesn't think about. Maybe someone says, oh, this child has been diagnosed with dyslexia, we'll support them in their reading or in their learning difficulties, but there are other factors that need to be taken into account. And you kind of manage that as well, alongside actually managing the patient and their needs. What are the most common things that you see in your practice or when you're on the psychiatry ward or the pediatric ward?
So commonly we see a lot of young children and young people with, so the younger they are, there tends to be kind of, we have two different pathways. One will be kind of neurodevelopmental, so thinking about problems with attention, hyperactivity, impulsivity, which is an ADHD type diagnosis, social communication difficulties such as autism. They're quite kind of common presentations that we see. It's kind of like our bread and butter. But they also have other comorbid conditions with that. So for example, almost 50% of children with autism have anxiety as well. So we will see an overlap of other conditions as well. We also see, as children get older, we see a lot of kind of behavioral difficulties. We see a lot of teenagers that may be depressed, anxious, quite severely depressed and anxious to the point where they're self-harming and suicidal. So we see a whole range of difficulties. And I think it's really important. And one of the main kind of take-home messages I wanted to give today is that a lot of parents come to me and say, there's a problem with my child, or, the problem is in the child. But actually, what we need to understand is that the child is representing a symptom of what's going on around them. So like I mentioned earlier, there's a whole network or a whole system around the child. We have to look at the child's home. We need to obviously look at the child's temperament, what the child is like within themselves, but also what surrounds them, their family, what's going on at home. You know, how are they being treated at home? What are their relationships like? How are they kind of interacting with other people within the home and actually within their community as well, with their friends, with their network? How are they interacting at school? A child could be bullied, for example, and that therefore may impact their mental health. And we know that children that are bullied, there's a higher rate of self-harm when they're teenagers. So there's a lot of different reasons why a child might be presenting with behavioural difficulties or mental health difficulties. And so you have to look at the whole system around them, that why is it that they're presenting in a particular way? It may not be that they actually have a mental health problem. So, for example, I get a lot of parents come to me and say, you know, my child's not sleeping very well at night. Does that mean they've got ADHD? Or my child's finding it difficult to go out post-COVID. We know that post-COVID, children are finding it difficult to integrate back into, socialising, and they found it more difficult integrating back at school with friendships. So parents need to understand that actually there is a lot of some of the patterns that children show, like in isolation, if they're having sleeping difficulties or eating difficulties or socializing difficulties, it doesn't mean they have a mental health problem. It means that they may be adapting to the situation that they're in. There may be an underlying cause, such as, you know, they're overtired from the weekend and therefore, you know, they're finding it difficult to sleep during the weekday. Or it may be that they're anxious about an exam, or they've had an argument with a friend, but they've not been able to express that. Children find it difficult to express themselves verbally, especially identifying and then labeling what the emotions are. So what parents can really do to help support their children is to name the emotion. So to say, for example, I can see that you're really struggling, or that you're looking really upset, or you're looking really worried. Are you okay? And the child might agree or disagree, or might want to withdraw and not want to talk about how they're feeling. But I think it's important as parents, as a community, to really try to look out for the signs of a child maybe changing in their behaviour, such as withdrawing from the family or withdrawing from society, and giving them that support when they need it, when they ask for it, and being available for them to be able to discuss how they're feeling and when they're ready to discuss that.
Yeah. Wow, that was quite, I think that was quite important answer to what can parents do sometimes when they identify that their children or their child might be a bit off. You know, I think I was always taught that the parents always know when there's something wrong with the child, or when they feel like the child feels slightly unwell. The parents are the first to feel it. What can they do if they feel that way and the child can't express it? We're talking about, like you mentioned, sometimes with autistic children, they suffer from anxiety. Some autistic children are non-verbal. So how then can you help trying to kind of identify if they're feeling anxious, or if this is just a pattern of behavior or something they just can't express? How are you as a parent, how can they kind of identify that, or when should they kind of be worried?
So that's a good question, actually. And I think that it's really important, if a child is non-verbal and not able to communicate verbally, we have to look at their non-verbal communication. So for example, and also their age, and what's going on at home and around them. So for example, if you've got a 2-year-old that's having a tantrum and rolling around on the floor, crying, kicking, shouting, for that stage of development, that's understandable and that's acceptable. If you've got a 12-year-old, well, actually, as they enter teens, they start to behave a bit like toddlers as well. But as they kind of progress towards adulthood, you know, you do get obviously teenagers having tantrums, and actually sometimes children just let off steam when they're at home, and it's a good sign if they're able to feel comfortable to do that with their family, because often they'll try to keep it together at school or during the day, and then when they come home they let it out. So you need to look at their non-verbal communication. What is their pattern of behaviour? If, for example, the child is non-verbal and hitting a lot, what is the reason why they're angry and aggressive? There's lots of different forms of communication. It doesn't just have to be verbal. So for younger children, play therapy is really, really important way of communicating their distress. So children can play with dolls, they can play with cars, they can play with, all sorts of different, Lego, brick toys, anything to express how they're feeling. Play is a really important form of communication for children under the age of about I'd say 9 or 10. And then also drawing, painting. Children can express themselves in lots of different ways. And you can kind of really, and get them to write as well, get them, whatever medium of communication it is that they want to express themselves with or that they feel comfortable with, get them to do that. And what parents need to understand is that when children and young people, when they become adolescents, parents aren't so important or don't play such an important role in their life as much as their peers do. So what's really important as a parent is to provide the child with a trusted not necessarily a young person, but a trusted mentor, a trusted friend, someone that the parent trusts and the child trusts that they can talk to or that they can express themselves to. Because often it won't be the parent that the child wants to talk to. It might be a friend, it might be an uncle or an aunt, or it might be a madrasa teacher, or it might be a football coach. It could be anybody, but as long as the parent and the young person trust that person, it's really important that the child expresses themselves. Research shows that children and young people that keep a journal or a diary about how they're feeling reduces the risk of self-harm. So any form of communication, it doesn't have to be verbal, is really protective in preventing self-harm and the deterioration of mental health problems later on in life.
Yeah, that's actually a really good point. And it's something that not just parents, sometimes older siblings, sometimes cousins, sometimes friends, sometimes even just community members, if they identify that someone is feeling, or a child is not doing or is not acting normally or behaving the way they usually are, then maybe everyone kind of has a responsibility to just try and reach out. So I think that's a great point. Do you ever get children or adolescents or parents even that might say, actually, there may be nothing wrong with my child because they don't want to have that label, or they don't want a diagnosis, but they do want help?
Yeah, we get both extremes. So we get parents that really want a diagnosis, and often their child doesn't have a diagnosis of a mental health condition. Or we get parents whose children need a diagnosis, or they have a difficulty, but parents don't want to necessarily get that label or get that diagnosis. So for those parents that don't want a diagnosis or that don't want to label, and to those children or young people that might be listening that may be worried about getting a label, what I would say to that is it's so important not to focus on the label or not to focus on the diagnosis. As a consultant psychiatrist, to myself, I am not interested in the label or the diagnosis, although I've been trained, obviously, to diagnose. What I am interested in is the person. I'm interested in their strengths, in their difficulties, in what is really bothering that young person in that particular moment in time. What is affecting their functioning? Why is it that they don't want to talk to their teacher, or they don't want to go to school, or they don't want to talk to anybody about their problems, or they're really hurting? It's really important to actually understand what is going on for that young person. The diagnosis is secondary. A diagnosis basically, or a label, just helps, I think, the young person and the family to understand the condition a bit better. So for example, we'll pick autism again because it's quite a popular one. Autism is a social communication difficulty, and we know that children and young people that have that diagnosis will struggle a lot in certain situations, particularly social situations and at school. And the same with children with attention hyperactivity disorder, ADHD. They may go to school and they may struggle, and they may get into trouble because they've not paid attention. And therefore, if their teachers knew that they had that diagnosis, it might actually help to support the child in school and at home. And also, we can give medications as well, and we need to have a diagnosis before we can give medication. And talking therapies, there's not just medication. So that's the reason why you have the diagnosis. It's more to kind of understand what the difficulties are, frame those difficulties, and really help the young person and their family to understand and manage those difficulties. If a family doesn't want to hear that label or that diagnosis, I won't go on about what the diagnosis is. I will talk about how we can help that young person to manage those difficulties, because that's the bottom line. Even if somebody doesn't get a diagnosis of ADHD or autism, but they think that their child still has it, it may be that the child's kind of in the grey area where they're not quite meeting the threshold for the diagnosis, but they still have some symptoms. So it's really important as psychiatrists or as psychologists or mental health professionals to understand how we can help that child with those difficulties. Not so much, oh, they've got this diagnosis or they've got that label. Does that make sense?
Yeah, because end of the day, your job is to help people, right?
Yeah.
It's to help the child or the teen or even sometimes the parents kind of overcome what is now becoming quite debilitating in their lives. You know, sometimes anxiety, depression, ADHD, like you mentioned. There's a lot of mental health kind of disorders or conditions that can become very debilitating in a patient's life, and can be debilitating for parents too, because they don't know what to do to help. And like you mentioned, supportive therapies, medication, those all happen after a diagnosis is made. So it's not necessarily a label, but it is still something that is taboo in our society, unfortunately, and more so taboo in our communities, being the Muslim communities. What has your experience been with Muslims seeking out help, whether in clinic, in practice, or even in community?
So my experience and also research that I've done shows that Muslim communities do not access mental health services in the same way that their white counterparts might. So we know that one of the reasons for this is the stigma that's associated with mental health. But this research that I did was about 15 years ago. So things have changed since then. And in practice, through my experience, I think a lot more Muslims are turning to mental health services for support. But usually I see them in crisis. So I see them where, you know, parents or the young person or the family don't really want to acknowledge the problem or the extent of the problem. They may feel that actually the child isn't really as depressed or as anxious as what they probably thought initially. And often it will be when it's quite severe, you know, and the young person is using lots of maladaptive coping mechanisms, such as self-harm or taking drugs, alcohol, you know, all these things that to cope with that anxiety or that depression. And so I think that it doesn't help that there's not that many Muslim professionals that are mental health kind of psychiatrists, psychologists. There are more so now, but I'm doing, we call it co-production in mental health. That I'm doing a project at the moment, working with young people that have lived experience of mental health problems. And it's myself and another Muslim psychologist that are trying to recruit young people from London to come and join our lived experience group to discuss how we can work together to improve mental health services for children and young people. And when we first started, we found that hardly any children and young people from a Muslim background or even actually an ethnic minority background actually signed up to our group. And after a year of really trying to kind of go out there to the local community, the schools, the network, and try to engage young people from you know, the same background as us, that look like us, it kind of made it more accessible for them. And now we have increased the diversity within the group by 50%.
Oh, wow.
And that's because I think we're more visible, we're more accessible. And if they can, and I think if Muslims see that there's, you know, Muslim professionals able to understand the cultural difficulties as well and context, as well as religious concerns and mental health, that obviously really helps. And we try to train the staff within NHS and private sectors to understand some of these cultural differences amongst different ethnic backgrounds and communities. But I think for Muslims in particular, I mean, it's the elephant in the room. You know, at the end of the day, there is this belief that a lot of people would go to an imam before they would come to a psychiatrist or a psychologist, because there is this concept of, you know, it might be black magic or it might be evil spirit possession of the person over this is actually, you know, a chemical imbalance in the brain, and it's actually, you know, depression or anxiety is a medical condition that needs to be treated. So I think that it's really important, you know, for those people that are really scared of what is involved, because I think some people may think, you know, oh, my child's going to get drugged up or medicated or sectioned and put away in an asylum or something,
Yeah.
which is not how mental health is nowadays. So to those people that are scared or that are worried about what would happen to their child if they were to be seen by a mental health professional, I would really reassure you that, you know, it's actually a safe space for a young person to be able to talk about their difficulties. And it may not be that they need to have medication. It may not be that they need to have therapy. It may be that they can just have 1 or 2 sessions with a psychologist or a psychiatrist to understand their difficulties, and then we signpost on to, you know, a youth worker or somebody that understands or is able to talk to them in the community.
Yeah.
So I would really encourage families from Muslim communities to seek help early. Because if you are concerned about a change in your child's behaviour in multiple areas of their life, whether that be physically, their sleep, their appetite, their social behaviour, their communication, the earlier you seek help, the more the chance there is to kind of manage that difficulty and actually what we say is like nip it in the bud essentially,
Yeah.
and then prevent the deterioration of mental health problems later.
Yeah, I think there's 3 really, really important points that you said there that I want to like kind of re-mention. One is the fact that we need more people that, like you said, look like us. So being Muslims, being ethnic, kind of to increase that diversity quota, but to also make it more accessible for people in our communities to reach out and seek help. Because I myself feel more comfortable going towards someone who is like me, because they might understand where I'm coming from.
Of course.
They might understand when I say, oh, my mum or dad or my brothers or my community or this event or this mosque event. They will understand that more than I have to go back to the complete basics with somebody who has never heard of the things that we do in our communities. So for anyone who is looking for a job, they should definitely go for kind of that sector, right?
Yeah, and I actually provide work experience as well. So if people are interested, they can contact, can I say the details?
Sure.
It's info@familywellnesspractice.com. And I share a kind of lot of resources for free on Instagram as well. So it's Dr. Kiran Nijabat.
Amazing.
So people can kind of access that through social media as well.
Yeah, amazing. And I think one of the other points that you mentioned was the role of faith in patients that may be suffering with some sort of mental health disorder or a condition, and the families that are bringing this child to you. You mentioned that the elephant in the room is that people go to the imam first, or people are expected to go to the imam first. As Islam or being Muslim is part of your identity, I'm pretty sure that it might have an impact on the management and the therapy that children or adolescents or teens or even the support network might need in kind of improving the health of this child or the patient that you're seeing. Do you ever kind of, and obviously in kind of modern medicine you can't really prescribe faith, but in your kind of experience or in your opinion, do you think that faith plays a big part in someone receiving mental health kind of condition can't say the word now, diagnosis?
100%.
Yeah.
So in my CPD courses and, you know, in my training, my research, my experience, we actually really push people to turn to spirituality. So it's not just confined to Muslims. You know, it could be Hindus, Jews, Christians. We know, research shows that spirituality is protective in really supporting someone's mental health.
Yeah.
So through prayer, through Quran, through namaz, through dhikr, whatever it is that a young person or a family need to turn to for support, they should do that. And I really encourage that, but not at the expense of then seeking mental health support. Definitely. So for example, I had a family recently that were finding it really difficult to accept that their child had depression. And so I think they expected me to understand that because I really did feel that the child needed to have therapy, but alongside that, they needed to have medication as well. And often I don't say, that they need to have medication. I'll only say it if I really do feel that they need it.
Yeah.
So we tried lots of other things beforehand, so I'm just kind of cutting a long story short.
Yeah.
But essentially what happened was the family then decided, without telling me, to kind of stop the child's medication. So we started her on antidepressant medication, stopped the child's medication, took her to see an imam, and wanted to kind of use that route to manage the depression. Which, alongside, I think if the child was still taking the medication and seeing the imam, that's fine. But to stop it and go against that medical advice, I think that's quite tricky, because people need to understand that there is a chemical imbalance in the brain, and that the medication is there to help treat that condition and to lift the mood and to treat, because actually with a lot of mental health problems, there's physical health problems associated with it as well.
Yeah.
So we know that in depression, for example, sleep is affected, mood is affected, energy is affected, appetite is affected, self-esteem is affected, motivation is affected, concentration is affected. So there's a lot of psychological symptoms that I've listed, but there's also a lot of physical symptoms.
Yeah.
So antidepressants will treat all of those symptoms, not just the psychological component. And so what people need to understand is that mental health is not just confined to the brain and the mind and psychology. It's actually, there is a huge interface and overlap in physical health and mental health. So just imagine when we're stressed, for example, how does our body react to stress? When we're stressed, we all kind of get impacted in different ways, but we notice that we become short of breath. We might notice that our heart is beating faster. We might get palpitations. Even now, like we're feeling a bit nervous,
Get
we might
tongue twisted.
You might have, sweaty hands. You might need to go to the toilet. Some children say they have butterflies in their stomach. So there's all these physical symptoms, as well as, the mind kind of pacing and catastrophizing when you're stressed and anxious. And so you can see that mental health is not just confined to psychological mental problems in the mind. It's physical as well as mental. And when people understand that both are linked and that it needs to be treated with the same importance as a physical health problem, then I think progress can be made within particularly the Muslim community in accessing help and services to treat children and young people's and adults' mental health problems.
Yeah, definitely. I definitely agree with you. And like you mentioned, that faith does play a part. I was actually reading a study very recently about so it was in the context of surgery, and they asked Christian Christian patients versus non or atheist kind of patients, and the Christian patients all had better outcomes because they had, I think they had like some sort of spiritual person come and speak to them. I don't think it was a pastor or anything, but it was just the spiritual talk just before surgery, and for some odd reason they found that there was better outcomes. We don't know why. They didn't really conclude why, but that's like a really famous study that showed that maybe there is a spiritual aspect. Faith, motivation, optimism, all of these things bring a patient up rather than the opposite, but you need it alongside treating condition. You wouldn't go to a doctor and say, I'm not going to take my heart medication because I pray. So it's kind of the same thing. Unfortunately, though, some people in our community just need to be reminded of that.
Yeah.
And coming from different communities and different ethnicities that you've seen, do you think there is a kind of aspect to generational trauma within the Muslim and ethnic communities? I know just before the show started, we spoke about the differences between the Asian community or the Pakistani community versus the Khoja, the Arab, the Iraqi specifically. Do you think there is an aspect to generational trauma that you see in your patients?
Of course. And I think it's not just intergenerational trauma. Patterns repeat themselves in families. So, for example, a pattern of, for example, if a family have been through war or conflict, as in the Iraqi community, a lot of, I've spoken to a lot of Iraqi patients and communities that have told me that, their parents and their grandparents have witnessed or have been through war and trauma. And clearly that level of trauma would have an impact on their parenting, on their ability to communicate with their children, and the way in which they parent their children and the younger generations. And I think that sometimes a lot of trauma is not necessarily processed, or, you know, like they're just expected to kind of get on with it, essentially, and just, you know, get through things without actually seeing anyone. Like, I think it'd be unheard of. But now I know there's lots of work that's being done by Al-Ain, for example, where, you know, there's lots of work, really good work that's being done with orphans and, you know, with children and families that have been through war and that have been through trauma. But it's not just that particular issue that I think, where I was talking about patterns of behaviour in families. We look at other things as well. Like, for example, you may see patterns in families such as anger. So some parents or grandparents may have always communicated by shouting or by being quite physically aggressive, because that was a part of their culture to be able to do that.
Yeah.
And then that got passed on to the next generation and the next generation. And it just takes one person to think, hang on a minute, this isn't working.
Yeah.
And I need to break this pattern, or I need to break this cycle. And it can work. And actually, by working amongst, you know, different communities, helping to support each other collectively, that can really help to break some of that intergenerational trauma and some of those reactions that I just explained, like, for example, anger as a form of communication. But also I see a lot of young people that say their parents don't really understand, or they're not able to communicate with the child or the young person in the same way that they you know, like they might use words that parents don't understand. Or, you know, with the rise of social media, with tech, with these apps, a lot of parents aren't necessarily, or older generations aren't necessarily able to keep up with the pace of technological developments and of, you know, their children's generation. And so a lot of young people will say to me, you know, my mum and dad just don't get me. And actually, now that I'm probably, you know, I'm getting older now, I think that sometimes young people might see me as like, you know, well, you're not going to get me either, because you're, you know, old, you're an old person, or you're, you know, not quite, because in amongst the mental health professional community, there's a lot of younger support workers that are available, and mental health support workers that can definitely relate to young people in a way that maybe parents, grandparents, aunts and uncles might not. So I think it's really important to be able to, and I kind of mentioned this point before, to whatever means of communication you need to use to understand what the young person is going through, and giving them the opportunity to express what they're going through. Like, as I said, it doesn't have to be the parent. It can be through social media. It can be through, you know, for example, there's Muslim Youth Helpline, which is like a confidential helpline service that offers support for young Muslims. They could turn to them for support. It doesn't have to be, and lots of young people like to use technology rather than, you know, or online media rather than speaking to people face to face now. That's another shift or a change. So there's a lot to kind of think about, I think.
Yeah, definitely. And there's a lot that with for example, COVID, the pandemic, there has been a very, very big turn towards technology. Even the way I study, the way that children do schools nowadays. I know that my niece did she does all her homework on an iPad now. Whereas when my brother was like raising my niece when she was a toddler, he always vowed that she would never become an iPad kid. But she has to now because of the homework. And so there's a lot of factors there where I know that my brother and his wife always discuss how we're going to protect my niece from the outside or the dangerous side of social media and technology. But it doesn't always have to be a danger side to social media and technology. There is, definitely. Can't neglect that. But as long as there's positive communication, I think, and there's supportive measures between, like, healthy communication between parents and their child, I definitely think that there is benefits to technology. And just children are just using it much better than anyone else nowadays anyways. And sometimes they're using it for their benefit and learning loads. I myself use social media all the time to, like, I'm always reminded of certain things through social media where I'm like, oh wow, I would have never learnt that through a book, because I would never open that book to begin with. Or even like the podcast that we're making now. I like to listen to podcasts on the way to work or on the way to my university. podcasts, you're learning something, you're educating yourself, would never have happened 10 years, 10, 15 years ago. So all of these means are healthy and they're positive, but obviously there is the dangerous side.
And it's kind of like adapting to the generation, right? So obviously nowadays, like you say, podcasts are so much, and audiobooks are so much more useful for people that are constantly on the go, leading, we're living in a kind of fast-paced environment with technological advancement, and so you kind of have to keep up or adapt to the environment. And it's the same with children and young people. You have to adapt to the children to a certain extent as well. Obviously, you want to hold on to your core beliefs or your values, and that's really important in developing that sense of resilience in a child or young person to know where they've come from. Even if it is intergenerational trauma, or even if there is kind of, a history of mental health difficulties in the family, or learning difficulties, or, any kind of disability that may have happened in the family, it's important to acknowledge that and to embrace that to an extent, because that actually does make up the core of what a young person is. But it's also important, with that sense of core self, that the family really adapt to what the child's needs are as well. And that's where I think there is a big problem, especially in the Muslim community, because what I think parents really do is they try their best to hold on desperately to the values, Islamic values, for example. They want their child to be honest, to pray, to, not go and be exposed to drugs, alcohol, whatever's out there.
Yeah.
We talked about social media and the negative impacts of that, but actually, parents are petrified of letting their children go out into the wider world as well, because of the effects of what could happen physically as well as what's online. So obviously there's this kind of constant weighing up of the pros versus the cons of any situation that the child might be in, and the parent wants to protect their child. That's obviously their instinct, which is to do that. But sometimes what can happen is parents can kind of overprotect the child to the point where the child feels quite suppressed, and then what they will do is they will rebel because they feel like they're not able to have any control or independence or autonomy over their life. So it's this really fine balance, unfortunately. As a parent myself, I find it really difficult to give a bit, take a bit. It's this constant, balance between trying to give your child autonomy, but also giving them discipline, giving them standards, giving them expectations and values and morals to follow by.
Yeah. Definitely, I think that's something really, really important, and I think a lot of the viewers will appreciate that forward advice, because in this upcoming generation, that is one of the main things that parents are worried. How do they deal with a child being brought up in a generation that, I can say that I'm exposed to technology from a young age, but perhaps even my older brothers, just about 10 years older than me, they were never exposed the same way that I was exposed. So it's definitely difficult, but I definitely think there's a lot of good parents out there that have managed, alhamdulillah. So what would you give us as like kind of your final parting advice, your knowledge nuggets?
At the end?
Yeah, we're already, unfortunately, there was so much to discuss.
Okay.
But so what would you say, just kind of your final knowledge nuggets for us?
I've got quite a lot, but I'll try to keep it short. So I think what I've been saying throughout the show is that physical health is just as important as mental health, and both connect to each other. And it's really important, just as you said, that if somebody had blood pressure problem or a heart problem or, constant headaches, they would go and see their GP. In the same way, if you notice a change in your child's behavior, or even in yourself or amongst your friends, and you think that, they've got low mood or they're quite anxious, go and seek that support from your GP, from a counsellor. Early intervention is crucial, especially in children and young people. And I think it's so important, especially as I know that lots of parents really want to do the best for their children, and trying to see the child, trying to look at things from the child's perspective as well, and thinking about the whole system around the child, not just the child themselves, but, look at their community, their family, their school, what is going on around that may be impacting the child's behaviour or their mental health. And as I said, really do seek that support early. And also, the one other, take-home message that I want to give is that do not underestimate the power of connection. just with one trusted person. So if a young person or a family member can turn to you about their difficulties and you think, well, I don't know what to do with this, obviously you need to signpost onwards to a relevant mental health organisation or to the GP. But just having a conversation where the young person or the adult that's feeling low in mood or anxious feels heard, that can be really protective and really supportive in preventing the deterioration of mental health problems and also building resilience in the child and the young person.
Yeah, fantastic. I think that is probably the most important thing that you can leave us with. And you've mentioned quite a lot of really, really important points. And I wish this podcast can go kind of longer. Unfortunately, we did have a little bit of technical difficulties at the beginning, so we did start a little bit later. I just want to ask you, I know the producer will probably be angry now, but just really quickly, what do you think is the best way to raise awareness or advocate for a child that you may think that needs mental health support?
I think there's lots of different ways that it can be done, but it needs to be done through that particular child or the young person or the family really going to kind of different organisations and getting as much support as possible. So being visible about it, not hiding, not shying away from community or being ashamed that, my child's got, I don't know, autism or cerebral palsy or dyslexia. Really kind of embracing what challenges there are and seeking as much support as possible and talking about it. Advocating. I've seen so many parents that talk on social media, that, talk in their local mosque or support groups, and they offer so much kind of empowerment to other people with similar difficulties just by talking about it and being visible.
Yeah. Well, thank you very much, Dr. Kieran. It's been a pleasure to have you on the show.
Thank you.
And like I said, it's really unfortunate that we have to end the show now because there's so many very, very important points to be raised. Maybe we'll have you on for a future show. But thank you very much. And inshallah, the viewers have been able to gain some sort of knowledge, some sort of advice. And the aim of the show is literally just to raise awareness and just to plant seeds of information in people's minds. So thank you again.
Thank you.
Thank you to the viewers, and inshallah we'll see you next Saturday for the next episode of Out of Sight at 7:30 p.m. Thank you very much, and ma'as salama.